I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. Most of the time, we speed through the day without thinking about the minutes and hours that pass. Some of us spend an hour driving to and from work, or lose ourselves in 30 minutes of mindless phone scrolling. But when it comes to stroke, those minutes and hours matter. As the saying goes, time lost is brain lost. A stroke is a medical emergency. Immediate treatment is crucial. Early action can reduce brain damage and other complications. To prevent brain cell death that is significant enough to cause a disability, treatment is most effective if it begins within 60 minutes of the onset of symptoms. It can still be very effective, though, if given within 3 hours. The CDC estimates nearly 800,000 Americans suffer a stroke each year. Strokes, especially ischemic strokes, which block blood flow to the brain, are the 5th leading cause of death in the U.S. In this episode of Health Inspired Talk, we're exploring the topic of stroke. We'll learn why minutes matter and take a closer look at the symptoms and prevention, as well as stroke treatment available at ThedaCare. Joining us first today is Kristin Randall, manager of our stroke program at ThedaCare. Thanks for being with us, Kristin.
Thanks for having me here today.
So let's start off with the basics. What is a stroke?
A stroke is when there's an interruption of blood flow up into the brain. It can be caused by a clot that either travels up to the brain or one that forms up into the brain. It also can be due to a ruptured blood vessel in the brain. So we have 2 kinds of strokes that we talk about that we'll be talking about today.
And there is an important acronym to remember when it comes to symptoms and maybe some warning signs. What is that?
It is be fast. So we are going to go through, I'm going to quiz you today.
Oh, no, okay. I didn't know I was being quizzed. I thought I was doing the quizzing. That's okay. So we have these photos here, and these all stand for the acronym, right?
Correct. So
Okay.
what is happening in this picture?
Person's face looks different on one side versus the other, right?
So this is what we would be looking for a facial droop.
Okay.
So what
So
would
that
you
stands
do?
for F, right?
What would you do if somebody had a facial droop? How would you test for that?
I mean, I would think if you're seeing one side of the face be different, so maybe ask them to smile.
Very good.
Something like that.
Yep,
Okay.
perfect. What
Right.
looks like?
Speech bubble. Cannot
Correct.
probably speak as well as they usually would, right?
Correct.
Okay.
So speech.
Speech, all right. Dizziness, head injury, some kind of
Very good.
dizzy.
Yep. Balance problem.
Oh, okay, so that's our B.
That's our B.
Okay, I.
I. Yep.
I got that one.
Vision problems.
Okay.
And what does this?
Time, calling 911 T.
Correct.
Okay, so that's our T.
You put that
All
down here.
righty.
And what? Final picture.
Arms and limbs different. One side is different than the other.
Correct. So when we put this all together, it spells out be fast.
Okay, so BEFAST. Okay,
Correct.
just maybe quickly go through them one more time just to tell us what we should be looking for.
So balance. If somebody's saying that they just lost their coordination or they're just feeling off, that is what we're looking for. Vision, are they losing part of their visual fields? Do they feel like they're not seeing everything? Facial droop, do they have one side that's drooping compared to the other? Arms, looking to see. If you have them hold both arms up, can they stay up? Is one drifting down? Does one fall down? This can also be your legs too. So it can be your arms and legs. Speech, are they having troubles understanding you? If what's coming out, is it slurred? Or are you having troubles understanding them also? And T can be 2 things actually. It can be terrible headache. If you are having the worst headache of your life, that is something to be taken seriously too. Or time is the other one.
Okay, so all stands for be fast and just reminding us to act quickly.
Correct.
Okay.
So, and really with time, the big thing I want to just stress here is to call 911. So those EMS personnel, they are part of our chain of survival, we call. They're a very important link. They're there to help us determine when was the last time you were known well, any medications that we should know, who is your family that we can contact. While they're en route, they're also getting us information about what's going on, your vitals, blood sugar. So they're a very important part of our team.
And that will help as we get further on down to patient outcomes, right?
Correct. And then once you get to the hospital, that team is there waiting for you. So the physicians will come in, take a quick look, see what's going on. Then we get you off to get a picture of your brain or a CAT scan. We want to know what is going on so that we know what treatment options we have for you.
Okay, good information. Be fast. Easy to remember.
Be fast.
Thank you for talking us through that critical information. Now we're going to talk a little bit about the stroke care that ThedaCare can provide. Our program at NENA is one of the comprehensive stroke center, and it is certified, right?
Yep.
Okay, so what does that mean?
So that means we are able to care for 6 stroke patients. So we're one of the only comprehensive in this region. So we are able to take care of the difficult head bleeds. We have the ability to do a thrombectomy, which is a treatment that we do just at the NENA campus. So really it is taking care of the sick patients. We also have rehab available. So we have our rehab therapist and rehab physicians there. Really a big team that's there to support you. Neurosurgeons, interventional radiologists.
A really comprehensive team, right?
Yep.
Okay, so it doesn't stop there though. We have a lot of different programs at our other campuses that can also lead up to that center. So can you talk a little bit about Appleton and the designation that we have there?
Yep, Appleton is a primary stroke center. So that means they have the infrastructure in place to care for stroke patients. They can do some of the treatments that we can do at NENA, just not the big thrombectomy or neurosurgical type cases, but they can care for patients that get the thrombectomy or the thrombolytic drug to NECTA-place. Okay. So those kind of patients can now stay at that hospital. They do have therapists there, not around the clock, but 7 days a week. So we do have therapy there too that can work with these patients.
Okay, so we know NENA, we know Appleton campus, and our critical access hospital in the rural areas.
Yeah.
What kind of designations do they have?
So they are an acute stroke ready hospital. That means, again, they have the infrastructure in place to care for patients, stabilize them. Some patients we are able to keep out at the critical access hospitals, which is great, keeping patients really in their community. Other patients, we get them stabilized and we transfer them to NENA if they need the more advanced care, or we can transfer them to Appleton now, with them being a primary stroke center. So we have a very good stroke system that we built here at ThedaCare.
And they're all working together to have that comprehensive care to make sure that all of our patients have whatever they need.
Correct.
All right, wonderful. Kristin, thanks so much for being with us today. We appreciate it.
Thank you.
Next, we're going to take a closer look at what happens when someone has a stroke and why it's so critical to act quickly. Joining us now is Dr. Carlye Reichert. You are a physical medicine and rehabilitation physician at ThedaCare. Thank you for being with us today.
Yeah, thank you so much for having me.
Can you tell us about the different types of stroke?
Yeah, so the two main types of stroke are an ischemic stroke or a hemorrhagic stroke. So what that means is ischemic means lack of blood flow. That's about 80% of the total strokes, whether that be an occluded blood vessel, a plaque, a narrowing of the blood vessel, or if you have different heart rhythms that can throw blood clots in towards your brain, like atrial fibrillation. Those cause brain injury because they stop the blood flow to the brain, and there's no oxygen or blood flow getting to those brain cells, and that causes brain death. Then there's hemorrhagic stroke, where there's extra blood on the brain, so that's usually an aneurysm or a brain bleed caused by high blood pressure, where they've ruptured a blood vessel in the brain, and the blood causes extra pressure on those cells and causes brain death. There's also TIAs, which is a transient ischemic event, which is signs and symptoms of a stroke, but generally they resolve within 24 hours.
Okay. All right, so now that you've given us kind of that overview of the different types of stroke, can you talk us through who might be at risk? I think a lot of people always picture older individuals as being at risk for stroke, but that's not always true, right?
Yeah, it's not always true. While age does increase the risk of stroke, it's not the only risk factor with stroke. It can happen from any time from being a child, 20s, 30s, and older. So as you get older, the age is a high risk factor for stroke, so we see it more commonly in our older population, but that's not an independent risk factor. So the two kind of types of stroke, or people that are at risk for stroke, would be people with high blood pressure, diabetes, heart disease, other health concerns, as well as the non-modifiable risk factors, such as women are more likely than men. Different races, such as African American, are far more common than Caucasian people to have strokes. And that also can go along with increased risk of high blood pressure and other comorbid diseases. Having a sedentary lifestyle puts you at increased risk. Having atrial fibrillation, that is a common risk factor as well.
So now that we know who might be at risk, throughout this episode, we've really talked about acting quickly when you notice the onset of symptoms. Can you just tell us a little bit about maybe some of the experiences that you've had with patients when it comes to stroke and noticing those symptoms?
Yeah, so absolutely. So the faster you act, then puts you in a different category for as far as treatment. So that if you are within the hospital and it's within a couple hours, usually about 3 hours from onset, then you're a candidate for different treatments, such as the clot busting drug or a thrombectomy if there's a specific clot in the blood vessel that we can see and possibly remove. That decreases the chance of permanent brain damage because you're restoring the blood flow to that area, and that really decreases the risk of disability. And so I've seen a lot of people where they come into the ER, they're not able to move that arm or that leg. They then go through the treatment, such as having the blood clot removed or that clot busting agent. And as everything evolves, they regain control of that arm. And it can be a pretty significant, dramatic improvement versus not being able to have those treatments. And it's more of a slow recovery over weeks to months.
Wow, so that really does talk about the importance of acting quickly. I mean, a matter of hours.
Yeah.
That they can notice a difference.
Exactly. And so a lot of times we see people saying, oh, it started before bed, but I wasn't really sure what was going on. So then they go to sleep and then they wake up and it's dramatically worse. And so now we're far outside of that window because that last normal is 8, 10, 12 hours ago. And so that totally changes our treatment options. So kind of if you're having any of those symptoms, it's very important to get to care quickly.
So is there anything that we can do for prevention when it comes to a stroke?
Absolutely. So we can't control age, we can't control our gender, we can't control our race, but there's a lot of lifestyle factors that we can play a role in. So high blood pressure, diabetes, heart disease, eating a healthy, well-balanced diet, not smoking, that's a very important risk factor, limiting our alcohol consumption to moderate or less, and then just really checking it with your primary care doctor and making sure that those comorbid medical diseases can be diagnosed early and treated appropriately. We see people come in with strokes due to high blood pressure, and they didn't know they had high blood pressure because it has not been checked. So kind of going into your primary care physician and doing those checks every year can be really important in preventing strokes.
Kind of get ahead of it before it begins.
Absolutely.
All right. Thank you so much, Dr. Reichert, for being with us.
Of course.
And thank you for watching. Remember, your primary care provider can help you manage your overall health risks. Visit ThedaCare.org and select Find a Provider to explore our care teams and make an appointment. We'll see you next time. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.